Hi everyone, Dr. Nemechek here. I want to touch on the idea of when you're treating SIBO with rifaximin, or with anything for that matter, it's not a matter of trying to cure SIBO, it's a matter of controlling it until the next time it comes back. And so what you're looking at here is the basic my simplified things. So you have these families of bacteria living in the small intestine. These guys live down here. You got a ratio of 1 to 100 million. Now, from looking at the data, my best guess is somewhere in the 70s and 80s, this started breaking down and you ended up with SIBO, where you have normal bacteria in the wrong place. And you can see this in certain conditions, such as the incidence of hepatic encephalopathy. So that's if you get SIBO, if you have a really advanced liver disease where you might need a liver transplant and you get SIBO, it's a condition that can kill patients. And so that started increasing in the 70s, 80s. Also, if you look, this is a driving force of autism. Those numbers, although they were at a consistent low level prior, they really uptick starting in the 80s. We start seeing an increase in that. And so here in this case, I've just had a lot of people who've been told by doctors or gastroenterologists like this concept that they were going to cure SIBO, and so they give you 10, 14 days of Xifaxan, which is the brand name of rifaximin, and it'll get you like this. But the problem is it's not really curing anything. It's not like you had Giardia or you had H. pylori in the stomach that was ripping up your stomach, and those treatments, when you're done, cured. The organism is gone, okay? It can't come back because it ain't there. This is a matter of organization. And so when you treat a lot of patients, you give them 10, 14 days of rifaximin, and they'll end up like this. And many, especially if your symptoms haven't been too severe or it hasn't gone on too long, stay like this. Maybe for a few months or a couple years. And then something will happen and it comes back. Okay? I try to prepare my patients in telling them it will always come back. Why? Because even though we have successful treatment, those bacteria that are going to overgrow in the small intestine are always here in the colon. And one of the primary factors that seems to cause spontaneous relapses, so when there's no real overt thing like intestinal surgery or real potent antibiotics that might trigger it, it is a function of slow intestinal motility. Okay? Anything that can cause kind of even a mild brain trauma, so this can be a mild head injury, this can be an emotional trauma, this can be an inflammatory trauma, like a SIBO or even a vaccine, okay, or a fracture causes an inflammatory trauma. Those things will cause the intestinal tract to slow down, and boom, back you go with SIBO again. So don't think of this as like trying to cure this once and for all, okay? It is a control therapy. Use rifaximin, you get control. You could go several months and it could come back. It doesn't mean the rifaximin didn't work, because it did. If rifaximin doesn't work, you don't feel better, okay, at all. And so this is a motility problem that's coming back. Now, what caused this to start building up from the 70s and 80s? We don't know. We don't know. I'm suspicious it's the vegetable oils causing some inflammatory damage to the neurological mechanism of the small intestine. We don't know. There is some evidence that the more highly processed food that people eat, the greater incidence of SIBO they have. But again, we don't know for certain. But just in your mindset, if you take rifaximin and you feel good for a few months, it worked. Okay? It's something else, though, will trigger the relapse, and you just have to take it again. So I hope that helps. Remember to subscribe to our site, and so you can hear more of our videos. Other than that, everybody have a good day.